Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Let's look at today's top medical news. COVID-19 vaccinations may prepare immune cells for future variant encounters. In a study published in the journal Immunity, researchers from the Perelman School of Medicine at the University of Pennsylvania revealed that the antibody responses to new SARS-CoV-2 variant infections and vaccinations are powerfully shaped by prior exposures to earlier SARS-CoV-2 vaccines. The researchers analyzed antibody response in people infected with or vaccinated against the relatively new SARS-CoV-2 variants BA.5 and XBB and found that even though BA.5 and XBB are very different from original ancestral version of SARS-CoV-2, the responses to these newer variants come in almost entirely from B-cell repertoire that was already in place due to prior vaccination against the ancestral strain. Detailing how SARS-CoV-2 immune history influences the antibody response to new variants through studies such as this one will ultimately help us design more effective vaccine, said study co-senior author Scott Hensley, PhD, a professor of microbiology at Penn Medicine. The study investigated how prior exposure influences antibody response to SARS-CoV-2 variant BA.5 and XBB, both highly transmissible and differing significantly from the original virus. Boosters targeting these variants were introduced in 2022 and 2023.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Prior vaccinations are highly beneficial for establishing memory B cell that can be rapidly recruited to produce neutralizing antibodies against new SARS-CoV-2 variants, said Hensley. Researchers found that individuals who initially had lower number of B cell elicited by the ancestral variant were more likely to produce totally new variant-specific antibodies. More importantly, people who had a high number of B cells against the ancestral SARS-CoV-2 strain were more likely to mount effective immune responses, which were mostly cross-reactive to the BA.5 and XBB variants. The main implication of the findings was that the immunological imprinting from the original ancestral SARS-CoV-2 strain had a significant impact on the antibody responses to the BA.5 and XBB variants and boosters based on them. These responses still appear to be protective, but it is unclear that the protection will remain robust as SARS-CoV-2 variant continue to evolve. Most people alive today have been immunologically imprinted by ancestral SARS-CoV-2, but that will inevitably change as time goes on. We need to continue studying how different prior exposure impact immunity to new variant that come down to the road and how this immunity affects viral evolution, concluded Hensley. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.